Hello, everybody, and welcome to another episode of Tinker Talks. This is the audio format podcast, and actually today, possibly video format podcast that discusses events behind the fence line of Tinker Air Force Base. Today, we actually have a rather large group of our senior leaders to sit down and discuss with us processes, thoughts, and some leadership on navigating through the start of the COVID-19 pandemic and kind of currently where we sit. So we do have with us Air Force Sustainment Center Commander Lieutenant General Gene Kirkland, Oklahoma City Air Logistics Complex Commander Brigadier General Chris Hill, 448 Supply Chain Management Wing Director Mr. Dennis D'Angelo, and my direct boss, 72nd Air Base Wing and Installation Commander Colonel Paul Filcek. So good morning, gentlemen.
Good morning.
Good morning.
Thank you very much for taking time out of your busy schedules to join us this morning. So jumping right in, General Kirkland, so a lot of people may not actually know what Air Force Sustainment Center is or how that works. So would you be able to just quickly kind of walk us through what the Air Force Sustainment is as far as who reports to who and where these bases are and how that chain works?
I'd be happy to. So as one of the 6 centers within Air Force Materiel Command, Sustainment Center is organized across 5 wings and 3 air logistics complexes or depots. And so at Hill Air Force Base in Utah, here at Tinker in Oklahoma, and Robins Air Force Base in Georgia, we have a pair of air base wings that run the installation and manage all the installation support and the air logistics complex. In addition, we have 2 supply chain wings, the supply chain management wing here at Tinker Air Force Base, led by Mr. Denny D'Angelo, who is an SES or General Officer Equivalent. And up in Illinois at Scott Air Force Base, we have the supply chain operations wing, led by Colonel Rob Henderson. So let's focus here at Tinker. So Colonel Paul Filcek, who's part of this morning, is our mayor. We look to him to support not only the AFMC organizations on base, but all the mission tenants here, the 507th, Navy Stratcom Wing 1, the 552, and all the cats and dogs to make up Team Tinker. Oh. His biggest customer probably is General Chris Hill at the Oklahoma City Air Logistics Complex. And so the 2 of them are the major AFNC units here supporting AFSC. But I get to work with also their counterparts at Hill Air Force Base and also at Robins.
Right. Awesome. So big job, lots to think about, lots to do, lots to coordinate.
Well, almost 40,000 airmen, both civilian and military, and I'm just exceptionally proud to be their commander and teammate.
Awesome. Thank you, sir. So going back to the early part of the COVID-19, at what point did the discussions begin between you and your leadership teams across the organization here, and kind of what were those initial conversations? What did they sound like?
At the beginning coronavirus, there was much we didn't know. And so we looked both upward and inward at our organizations. First as to what does the makeup of our team look like? And we relied heavily on the Department of Defense and Headquarters Air Force to help us translate the Centers for Disease Control criteria for our workforce into operational effects. You'll hear throughout this, I believe, that we've been trying to balance protecting the workforce with a requirement to keep the mission going. And that has evolved as we've learned more information, both external and internal. And I would turn it to these other gentlemen as to what we looked at both the wing and the complex in the early days.
Colonel Filcek, maybe you could, your job is, you kind of spearhead how the installation is going to stay open and operate, which obviously has a great impact. So what were those early conversations like?
Yeah, so at the risk of maybe pre-answering one of your future questions, you really do pay attention right off the bat to health of force and a risk to force and risk to mission, right? So we wanted to maintain the complete healthy status of our airmen and our sailors. For me, it was across all of our mission partners. So you had airmen, sailors, defense agencies, and the ALC, 5 wings in total. You want to keep them safe, but you cannot guarantee their safety. There's no way that, given the unknowns of COVID-19 and really our lack of data at that point as to how bad it might get, you knew that you had to balance the health of that force with the mission. And with that, you had to take a twofold approach to it. You had to go after prevention and reach where you can with prevention, and then also simultaneously build a response mechanism. So we had that twofold approach that we were talking about in February, or very early February, deep into March as this kicked off locally. But it wasn't done in a vacuum. And I'll talk a little bit more from the installation perspective and some follow-on questions. But we, as General Kirkland said, we had help from above. The Department of Defense and the Department of the Air Force and our Major Command, AFMC, were all engaged from the very beginning, and there was a lot of crosstalk leading up to it.
So, sir, who begins that conversation? Does that start with General Kirkland, or does that start at your level?
Well, the conversation, there's many pieces to the conversation, right? So you have an enterprise level conversation that's taking place right when this hits Wuhan, in December and January. The enterprise is looking at it immediately. And as you see something like this coming, General Hill is talking to his team the entire time. This isn't taking anybody by surprise. It's just, how do we address all of the unknowns with this, and how do we become pre-armed to address it? General Kirkland, from the AFSC perspective, was already drawing his ALC commanders, his Air Logistics Complex commanders, and his Air Base Wing commanders, and his Supply Chain Wing commanders in conversations very early on this. So then we're all going down into our teams and pressing forward with our plan. So I'll get into it right now, and then we can let it go where it will. Every single installation has a disease containment plan, and every installation updates that plan every single year. And so you take that disease containment plan, and you have these overarching health protection condition guidances that come down, and then your disease containment plan is right in line with those different echelons that you can take in response to COVID-19 or any other pandemic or epidemic. And you take those and you translate them into workable checklists so that you can just create your strategy for prevention and for response and escalate as the unknowns become more known.
So, sir, would you say that discussion happened for you as well pretty early on in this stage of, I guess, looking at it, like General Kirkland said, nobody really knew in the beginning, but what was that conversation like with the bosses very early?
So our discussion really sort of relays around an anecdote that started on or about the 20th of March here locally. And on the 20th of March, the weather and safety leave had been approved for all high-risk employees who had one of 6 comorbidity factors, and enabled folks to go home and take leave for their own protection. That was on a Friday. By Tuesday, we'd had 3,500 of our direct labor employees, 3,500 of 8,400 direct labor employees on weather and safety leave. And by Friday of that week, that number was up to 4,800 employees on weather and safety leave. So then we knew that we had an immediate challenge to balance our responsibility to do the mission, and recognizing that our mission is assigned here as core workload, meaning that it was so important to the nation that it had to be assigned to an organic Air Force depot in order for us to get that work done. And we looked at that mission requirement and that particular workload, knew exactly what units had to be recalled and get back to work. Those units then defined the skills that were required to get our mission essential workload out. And then with close collaboration with our bargaining unit, we were able to determine who we were actually going to call back to work when, and at what thresholds and echelons we'd be able to do that. Before we called back any people, we had to plan and provision cleaning, as well as, and the boss likes to call it conspicuous cleaning. We had to plan for and resource conspicuous cleaning and the personal protective equipment that we knew we were going to need for our employees. And it's an interesting story because about that same time, masks were hard to find. And we had an employee actually put 2 and 2 together and said, during this crisis, there were a lot of businesses that were closed downtown, and one of those businesses were the nail salons, for example. And so this individual had the idea that let's call suppliers to those nail salon places, and see if we might be able to get face masks that were used by nail technicians in salons. And so that's exactly what we did over a weekend. And by Tuesday of the following week, we had about 11,000 masks here ready for our employees, and that's what allowed us to sort of preload their return. So I would say it's a combination of balancing as Colonel Filcek said, the risk to our mission and the risk to the workforce, and also it was very important for us to highlight to the employees how important our work was, and to say thank you to those employees when they came back. So over a period of weeks, we've got back up on step, and proud to say we're at 100%. And we think we've got a good system in place. We also know that we've got to be agile. We can't take our eye off the ball. This environment is going to change, and we need to be ready in advance of that change.
Incredible. And some great ideas pop out of this.
Can I add real quick?
Sure.
What General Hill didn't mention was him and his team, they were thinking ahead on this and came to our medical group for a public health official as a direct liaison to the ALC. So none of this was done in a vacuum in terms of every step along the way. They had public health guidance and recommendations and didn't take that onus on themselves, and that being in line with the Centers for Disease Control, exactly what they would recommend and lay out, what the public health experts would lay out, and then General Hill and his team then translated that into meaningful action on the floor.
Paul, let me jump in and interrupt you, because I want to compliment your team because we couldn't have done what we were doing without the support of the installation, and the Wildcatters stepped up on this. First and foremost, we needed legal's expertise to know that we had it within our authority with the guidelines that we'd had from the Department of Defense, what we'd had from the Air Force, as well as from the CDC to be designated as a mission essential activity. We needed to know that we could actually call employees back to work. And within a real short order, legal gave us that, confirmed that authority, and enabled us to make those tough decisions. Secondly, we knew that although we had a plan, we didn't have a playbook. So a lot of things that we were doing were really dynamic. There was a lot of uncertainty and ambiguity in the environment, and so we decided that we were going to have a daily synchronization call that not only had our team on it, but also had our mission partners. So we had Denny D'Angelo's team from the supply chain, as well as DLA on our synchronization call. And the E.F. Hutton of that call was Paul's team from public health. And Dr. Everson was, when that guy was talking on the phone, no one else was talking. And we were all certainly taking copious notes. And he helped guide us not only in implementing the right plan, but really interpreting, in some cases, conflicting guidance that enabled us to make the right calls. It kept us from really making unforced errors, and really promoted a lot of good questions and answers from across the team. So it wasn't just the ALC team that was asking questions, the DLA was asking questions. Denny's team from the supply chain management group we were all had the opportunity to interact, and public health has been very, very faithful, not only on the phone, but also to come through our work centers, not in response to an outbreak, but also in advance of calling people back to work. They were actually to come out, and we would present our plans for physical distancing, for barriers, for personal protective equipment. We'd show them what we were going to use and how we would clean, and they would give us a thumbs up to say, yep, you guys are on it, or hey, we'll tweak it this way or that. And we were able to really have a better plan because of that collaboration.
Right, sir. So that does bring me to a point that, at what point do you start coordinating with your health team to figure out when the health protection conditions here may have changed?
That's a continuous process. That starts at day one, and it doesn't let up. It hasn't let up even this weekend, as we discussed the latest cases on installation over the weekend. As you recalibrate with the state's cases climbing, you then look for different data sets, because your parameters on what you need to do have just changed. And we just discussed yesterday where I said I need a new report every single morning on hospital beds and ICUs locally within the counties, and we're going to gauge that level of resource consumption in the local communities. Because one thing we can't do, no matter what we're gauging towards, one thing we can't do is let ourselves get to a point where, if we can help it, and of course we can't help it, some of it is out of our control, but one of our primary drives need to be don't reach a point where when somebody does get sick from COVID-19 that they don't have a bed to go to. So that's an overriding concern, and you get that information through your public health officials as they get with the state and local public health officials, and they mine the data and they deliver that. When we went to health protection condition Bravo, it is never done in the absence of a recommendation from the public health, and the public health will examine where the trends are going, both with positive rates and with testing volume relative to total cases. Look at the total volume of cases on its own merits and the risk to installation, and they made the call that it was okay to go to Bravo on 8 June. But at no point in the ALC, in the 552nd Air Control Wing, STRATCOM Wing 1, Mr. D'Angelo's 448 Supply Chain Management Wing, and the 72nd Air Base Wing, and all of the other agencies are all caged to public health and what their recommendations are.
Right. And so, sir, it's an interesting dynamic here, because the brunt of the responsibility for all of the installation services and the amount of people that get affected by your decisions weighs on you. Was there ever a point in time where you felt pretty heavy with coming to these decisions, even the hard one?
Yes. But I would say that's a shared responsibility across the installation. General Kirkland, as the commander of AFSC, carries that responsibility as a heavy weight. And what's really interesting about that is none of us are in this alone. There's an installation commander perspective where I'm responsible for the health of members on the installation and for the security of members on the installation. But it's not done alone. And every time we went to a system where we were doing crisis action team updates. We started at 3 times per week, then went to 2 times per week, and then once per week, where the entire installation is invited to discuss these things and what the next measures are going to be and what medical's recommendations are. And I always ended those meetings very sincerely thanking all of the commanders on our installation, because only by them actually tailoring the installation's parameters to their needs to meet their mission, and doing so safely, only by them being successful at what they do, ultimately is what keeps the installation successful.
Right. And so, General Hill, we kind of already touched on this a little bit, but what considerations and factors did you have to take into account when looking at the workload disbursements and bringing people back to work at some juncture when they started coming back?
So at our level, in an organization that's got more than 10,000 people, we knew that we couldn't make tactical decisions for all 4 of our product groups at the complex level. So empowering subordinate commanders and directors was a really important part of the process. And then having an environment where we could collaborate, where we were transparent, and where it was okay for commanders to engage one another, and there was trust that they could ask questions and we could ask questions of one another. That's really what I think enabled us to maintain the flexibility that we needed to meet each individual set of circumstances in the environment, whether we're talking about one of 54 different production facilities, whether it's hangars or back shops. There's a lot of different variables that are in that environment itself. There's a different environment across the workforce, right? So whether we're talking about at-risk demographics or the type of work that employees actually do. That varies a great deal. And so I think that flexibility was really critical to allowing the units the margin that they needed to make their best decisions, to get the right employees back, to do the right workload at the right time. And certainly the support that we had from the installation, and certainly from the empowerment that we had from the boss, was an enabler to make that happen. They say that command is full of paradox, right? That you can be in similar situations and come out of having completely different reactions to similar situations. I will tell you that I've never been in a situation like this, but over the course of my career, I've been comfortable making decisions with in environments of ambiguity, in environments with uncertainty, and maybe some volatility. And this was certainly one of those examples. But I'm really, really proud of the team and the trust that we had in the team of leaders. Really reduced what I felt like was risk, because I knew that together we weren't going to make terrible decisions. And looking back in preparation for this today, I don't know that I would change any one of our decisions that we'd made up to date.
I think that's a pretty incredible statement. That says a lot for you and your teams, for sure.
The team gets all the credit.
No, thanks, sir. So, Mr. D'Angelo, you've been quiet, sir. We've talked quite a bit about the operations in the complex and all over the AFSC organization, but we haven't talked about perhaps one of the most critical and maybe sometimes not talked about pieces to this puzzle, and that's the supply chain. How did you begin planning across your organization to safely keep the supplies moving so that everybody else here could continue doing their operations?
Sure. We're a little different than the situation here only at Tinker, in that we have locations at Hill Air Force Base as well as at Warner Robins Air Force Base. We're actually closer to AFSC the way they're aligned than maybe the wing is. Right. So I'm going to broaden this a little bit, because even though it's a Tinker focus, I'm going to tell you that even at Tinker, sometimes we touch everybody in the corners as well. So we, like everybody else, about the mid-March timeframe, realized that COVID was more of an issue than we maybe had anticipated, at least at my level. We started to look at what we needed to do to protect the force, as we had said before, because that was critical. And we kind of shifted our focus, basically people first, mission always. All right. We knew we had to take care of the people, and we knew we had to do some things. Now, I was actually very blessed, because what had happened is, prior to this occurring, back in about the maybe August to November timeframe, we had a situation in the area here that drove a lot of the folks out. We had some mold issues, and we started to actually telework ahead of time. So while we were doing the teleworking for the condition to abate the mold, we started to revise our continuity of operations plan that we had in place to be able to displace people more easily. And even though that was more of a Tinker focus issue, we started to work with the groups by doing some types of, I would call them tabletop exercises. Right. Not anticipating COVID ever being an issue. We always thought it would be, hey, what would happen if something like a storm came through or whatever? So we developed a pretty robust teleworking capability. And then when the situation came to the point where we said, hey, we might want to think about taking our people and protecting them by dispersing them back to the safety of their homes, we were in a place where we could exercise that continuity plan. And it was actually very fresh in our minds, and we had done it. So that's what we did. We basically came in and start looking. We made some calls basically to all the wing commanders to make sure that they knew that we were about to disperse a large portion of the workforce at the three locations, and we sent our folks home. We learned a few things while we did that. First of all, even though here at Tinker and at Warner Robins we had enough IT equipment to run, and at the location at Hill Air Force Base they didn't have quite enough, so we actually allowed people to take home their full computer systems to do it. But we immediately went back into our ability to support the supply chain. Why? Because the majority of the material that we support is done through the computer networks that we have, and we can actually tag back into those networks from a distributed location. Right. So using the continuity of operations plan and protecting the people by putting them back out away from the work area, we were really able to continue to be connected and do the mission that we had at hand, which is to supply warfighter dominance to the Air Force. Over.
Pretty incredible how some of that planning, you just don't know it's coming.
I would add to Mr. D'Angelo that even as we've been returning people to the workforce to accomplish the industrial tasks, that where folks are teleworking and doing so effectively, we're in no rush to bring those folks back to the office place, which will inform future decisions on actually how we do this. If we've demonstrated that we can effectively work from home or mostly from home or elsewhere, maybe we don't need quite as many cubicles, or we can maybe share workstations going forward. Mr. D'Angelo's wing or other staff functions that are largely administrative or work in offices are looking closely at what this means going forward. I would add, though, that I don't want to assume that we can continue this indefinitely. There are aspects where in-office, in-person interaction is necessary. Using Zoom, using CVR Teams, using the telephone can be effective, but it may come at a cost. So we're looking at that very closely as to what it means going forward. With that, we've been doing some of our onboarding and training virtually as folks have joined our team. The folks who went into telework on day one of the pandemic were by and large trained, experienced folks who already knew each other. Going forward, that as we incrementally replace them with new employees and folks who need on-the-job training and mentorship, we need to figure out how to balance that in terms of virtual and physical presence.
All right, so still a lot of work to be done.
I'd like to tag on to that because the boss's leadership in this area has been very important to all of us in how we do this. I talked to General Kirkland before we made any decision on how we would return the force. First thing we did is we went out to all the ALCs and said, how bad are we? Are we doing okay with our distributed workforce? And most said, yes, you're doing fine. We don't see any limitation in the way you're doing business. So we developed what we consider to be a lagging strategy. We decided that we would come back last, with the highest risk people coming back at the end.
Right.
And the reason we did that is twofold. Number one, we wanted to make sure that we didn't compete for the resources that General Hill, Colonel Filcek, and the other ALC and wing commanders had told us that we're in tight supply. Okay, we didn't want to compete for masks. We didn't want to compete for cleaning materials or drive a really high bill early on because we pulled everybody back when we really didn't need to.
Right.
So we're going to lag. Matter of fact, we're not even all the way back now. We're only about 85%. And we will probably stay at that for some time. The second thing is we wanted to make sure that we were able to provide the type of resource, the area for protection as well. So what we did is we went out to each one of the ALCs through our groups, and we determined exactly what we thought we would need to support the mission with in-person staff, and then we just allowed the rest to remain home. We realized, like General Kirkland said, there's a big pressure on culturalization. How do you bring in new people? I have lots of new people that come in often, and we've looked at things such as these people on board, we do some in-place, in-person touch points with the restrictions for COVID, keeping the distancing, and then we go back on to meetings using Zoom and other types of distributed means so that we can keep in touch with one another in a visual sense. Right. So we can see each other, we can talk issues out with those folks. We're learning from that, but I think we'll do well in the future in the way we bring people on and the way we do work day to day, because you could reduce the amount of cost in upgrading facilities if you had a portion of your workforce that rotated through teleworking.
Interesting. Who knew we weren't just the generation of cell phones? I mean, we actually do require some human interaction. And so, Mr. D'Angelo, you not only have the task of moving supplies across multiple states into multiple organizations, but you also have to acquire supplies from vendors that aren't within the Air Force system, and they have their own set of rules and how they were dealing for this pandemic, and it was different all over the country. So how hard was it for you to keep successfully working with all of the different pieces that bring the supplies in to your organization?
I would say that, remarkably, it wasn't as hard as I thought it would be. We had open lines of communication with the majority of our suppliers, and through distributive means, we were able to keep in contact with them. I also have a organization that deals with supply chain risk management. It's only three people, but they were able to leverage information that came out of Department of Commerce and other areas within the country that allows us to see what the impact would be in certain areas. California and in Florida, they have a large number of suppliers, and we wanted to keep an eye on those. So we had a special focus on those locations to see how things were going. And then we did normal touch points. The groups went in, and at their level, they made normal touch points with the major the contractors to see how they were doing. When the stimulus package came out, we also looked at how that stimulus package went down to help not only the primary providers, those contractors, but the second and third tier suppliers as well, because some of those are small mom and pop organizations, and if they don't get the money, they probably won't exist in the future. And we want to keep the industrial base warm and capable in the future to not only do our work, but to do work for the nation. So using the supply chain risk management, using our existing ways of communicating across the enterprise, and then the groups continually feeding up information so that we would, if we needed to inject, we could inject at the right level, either at mine, General Kirkland's, or even at a higher level such as with General Bunch. We were able to keep the supply of material coming in.
Awesome. And so, sir, you also obviously leading a team that's very geographically separated by nature. Were you seeing a lot of the same situations across all your organizations that we were doing here? How were you able to work through, or so far having been working through, being separated from all your leaders and not being able to take the trips?
Well, first of all, I have a lot of confidence and trust in the leadership teams, from the commander, director, all the way down to the first line supervisors. I'd say that the geographic diversity also could be a strength in that we were able to very early on export best practices from one location to the other. I'll give you an example or two. At Robins Air Force Base, the wing there determined how to train units to do their own contact tracing. So the public health officers that Colonel Filcek mentioned, that their abilities could be multiplied many times. And in the early throes of the pandemic, it was very important, it remains important, to very quickly do contact tracing to figure out how to contain the spread where there might have been a case of one of our teammates who tested positive. And in General Hill's case, I believe they were very quick to understand how to apply boundaries to the workspaces, dedicated entrances, dedicated bathrooms and break areas, so that individual units, we could first prevent the spread of COVID, and then if it were to occur, contain it to a smaller population, and therefore enable our force. So through the 3 air base wings, through the 3 air logistics complexes, the trading of best practices was rapid and frequent, and has a lot to do with the way this center has postured itself. I've learned as commander, again, in my career, that it's easy to make policy at the aggregate level. And this is what comes down from above, from our headquarters. And it all works, and we get nice papers with nice concepts. But the reality is it has to be applied at the individual employee level, whether they're civilian or whether they are military. Because that employee, he or she has a family. They may have a sick relative at home, and the fears, the concerns, the unknowns are very individual and very specific to them. And so with that, I mentioned trust. We trust our first line supervisors to account for those, to manage them, to work with the individual employee, to assure them that these are the processes we're going to use, these are the procedures, here is how we will operate with this protective equipment, here is how we will clean, and if something goes wrong, here's how we're going to react. And while there are thousands of individual stories, I think by taking time to stop and make sure that those first lines understand their responsibility and accountability to be that interface between the larger policy and how it's applied on the floor or in the office or even to teleworkers is really, really key to how we've approached this. And I would add that, and General Hill mentioned this, that our bargaining unit teammates, our local unions, here at Tinker, Mr. Jeremy Ross, at Hill Air Force Base has been Mr. Troy Tingey, and at Robbins, Mr. Marion Williams. The three of them with their local unions have been tremendous teammates in advising and listening and then making recommendations to us and then going out with a shared approach to communicate how we would proceed through this pandemic with our employees.
Awesome. Fantastic insight. So, Colonel Filcek, with the AFSC headquarters actually being here, what extra considerations do you have to make or do you make from your end on dealing with this COVID pandemic?
So you're going to have me follow that and then ask me how it is having AFSC here. What's interesting about that is General Kirkland already hit on it. It has been so collaborative across the entire enterprise. What General Kirkland does and what General Hill does as well, what Mr. D'Angelo does, everybody gets it that enterprise solutions are best, right? And that we leverage off of each other. We leverage off the lessons learned. We leverage off our previous experiences. We use our guidance. We don't let guidance replace leadership. We then apply leadership within the bounds of that guidance. General Kirkland completely trusts all of his commanders at all levels, and that conveys as we try to problem solve our way through this. So having him local, it's interesting. He'll have his opinions locally on what we may do, but has never once enforced that. He has just used it as an advisement mechanism, as General Hill and Mr. D'Angelo and my fellow wing commanders in the operational wings. It's been nothing but collaborative the entire time.
Awesome.
You would say about our boss would be this, and he's here in the room, so I'm sounding like I'm schmoozing him, but that trust is relayed by not micromanaging us. He gives us clear direction and guidance. He trusts us to execute that, and how we execute it is kind of up to us, as long as we come out with a goal. And that's extremely important for us to be aware of at whatever level the people are that hear this, that your leadership trusts you to execute, and we'll give you the guidance and the tools to be able to accomplish it.
Awesome.
From the top.
That's important. And so this really for the team, this pandemic is pretty much unlike anything I think even General Hill had mentioned. It's unlike anything you had been a part of or seen before. Have any of you found any leadership lessons to be unique trying to navigate through this?
I wouldn't say that's unique. I think the hardest thing we have to do, irrespective of a pandemic, is communicate. And it's times like this, I think, that just reinforce how important it is for us to communicate, not only inside of the organizations, but outside as well. It's very, very easy to think you've effectively communicated by broadcasting a message, but you've got to be able to sense and respond and then receive and listen to make sure that what you're saying is actually being translated correctly and understood. So I would say that communication has been the hardest challenge that we've had, and we're still working really hard at that.
Awesome, sir. Let me piggyback on that, because that's beautiful. So the communication, and we're not just talking about what General Kirkland talks about, getting it down to the point of execution, getting it down to that frontline supervisor and the people who are doing the work, but the families and the dependents and the people who aren't at work, who are curious as to what's going on, and keeping them connected. I would say that in this case, we didn't fail, but we didn't succeed to a degree I would have liked, which is a valuable message for me going forward. When you deal with something like this that is inherently going to isolate, as you could see the escalation coming forward and the great unknowns with COVID, realizing that we were going to isolate our workforce, I would have probably gone even further on the communications strategy and employment before we ever entered into Alpha and Bravo and Charlie and be in front of that curve. We made up time very well, ended up being a very effective communication base, but very early in the game, have that purring like a kitten would have been nice.
Let me jump in on that one as well.
Sure.
I'll take it actually even down a little bit lower. First of all, communication, extremely important. I also found that I probably didn't need as many meetings as I had. Right? I found out that I could actually accomplish things without even being in front of folks, which I prefer to be in front of them, but many times you can't be. So we found new ways of touching our people, new ways of extracting the information, and new ways of being even more effective and efficient than we thought we would be if we were in the same spot. And that's not because of any direction I gave them. That's because of the resiliency and the tenacity of the people that work here on this installation. My people, they came up with the ideas. I didn't. I was just a guy at the top that said, execute that. That sounds like a great idea. Let's go forward with it. So the tenacity of the people, the resiliency that they have, and the agility that we've all talked about is what really got us through this. We might have given our, direction and our guidance from on top, but they were the ones that executed it extremely well. So it enforced my trust, it enforced the object of communication. Yep, I'm going to have a few less meetings when we all come back, and there's probably applause now when people hear this. But we found out that we could do a lot of things when we were under extreme pressure, and we could do it very well.
Right. General Kirkland, sir?
There's been several aspects to this that I didn't anticipate. But throughout it, we've been aware and mindful that our Air Force remains open for business. We continue to fly, fight, and win. We are operating around the globe today. We've never stopped. And with that, the Sustainment Center's mission to fix airplanes and missiles and engines and parts and keep the shells healthy across our Air Force has never been more important. And so that's been context for that we needed to stay open for business as well and meet that need. The circumstances of that certainly became more challenging and specific to the mission and the location. And so you've heard our commanders and directors talk about that balance between mission and the obligation to protect our workforce. And so that has been different. And I would add to that it's also made me mindful of the many people that perhaps we didn't take for granted, but we didn't recognize their contribution along the way. Public health officers have always been there, but we didn't give them the credit that now we realize that we should. They've been tremendous through this and working with the state and local agencies and communicating that to the individual commanders and directors. The butchers in the commissary, the child care worker in the CDCs, the defender at the front gate. I could go on and on of folks who make our installations run and kept them open, fed us, kept us safe, our engineers who kept the lights on. We have a series here in the Sustainment Center called Frontlines at our 3 locations, which I am very proud of, that recognizes these folks by name individually. Also, this pandemic is not over. Right. This is an unknown duration, and so as we've made adjustments, we have to also be aware that we just don't know how long we're going to have to operate this way. This could be the new abnormal, as our Chief of Staff describes it, and therefore there is a cost to that. Maybe introduces slight inefficiencies. And so as we get into the 3rd, 4th, 5th month of this and get into the summer and fall, and until there's a vaccine or until there's herd immunity and things return to something that looks like pre-COVID, and that's not guaranteed, at this point, beginning to ask the units, what have we lost? What are we not doing that's introduced risk? And the answer is clearly we've lost some things. Well, Mr. Angelo said we've gotten rid of some meetings, and that's probably a good thing. But along the way, whether it's quality assurance oversight, whether it's things that our Inspector General might look at, whether it's just daily oversight of our processes, we've probably scaled back on a few things. So I'm asking the leadership to look at what risks we created and what are the priorities among those that we need to go back and look at before we just get into the new normal.
Will this pandemic be the most challenging event in your career for you to have had to work through?
I'd say top 3.
Awesome. Colonel Filcek?
That's perfect, sir. I was going to say no, but I'll just say top 3. It's in the top 3.
Top 3. Mr. D'Angelo?
It would not be my number 1. I think 9/11 actually had a good one on that one and everything that spun off of that one. And that was actually some of the reasons, but I put it in the top 5.
Right. So, and maybe some of the things we've learned over the years since then have helped. General Kirkland?
I hit this earlier. It's different than all the others. Each of us have probably inherited a failing organization. Most of us have been deployed to war zones and supported combat operations. Most of us have reacted to something like 9/11, but the path forward for those were, I'd say, more certain, and we knew where the end point was. we accomplish our operational objectives, and then we come home. This one is open-ended, and therefore informs how we're going to do this. And we don't quite know where this will go yet. And so I would say it's been the most unsettling for me, and the most uncertain.
Right. Awesome. So I think that's a pretty solid place to end this conversation. But before we do get out of here, sir, General Kirkland, is there anything you'd like to add before we get out of this?
Just my tremendous appreciation and respect for the men and women that make up this center. We're talking about the coronavirus pandemic today, but every one of them has a story. And every employee in our center has stepped up in his or her way to continue the operations of this center and make sure we're supporting the warfighters.
Awesome. And so with that, thank you, sir. Thank you, gentlemen, for taking time out of your very busy days to sit down and talk through this. As you've all pointed out, we're not through this yet, but it's a key discussion to have, and it's important for people to see what the mindsets and what it's like behind the scenes to figure out how we work through this. So with that does bring to end another edition of the Tinker Talks podcast. Thanks for joining us today. Please don't forget to check out our website, www.tinker.af.mil, and there's a COVID-19 tab on the top of that website that you can get all of the latest news and updates on COVID-19. Also, please don't forget to check us out on social media. That's at Tinker Air Force Base on Facebook and Instagram. And on Twitter, of course, that's at @team_Tinker. And so until next time, everybody, please be safe, be kind and respectful to one another, and have a great day and a better week.